Hello, welcome to another episode of Let's Talk. Today's topic, we are going to be talking about the assisted living R9, 10, 121. This is all about the disease prevention control. So this R9, 10, 121, a lot of care homeowners are getting dinged because they don't utilize the protocol that they should do. For instance, like right now, although the Department of Health Services coming in to survey your home, they're expecting you to implement that protocol, okay? But for the meantime, let's go ahead and study this R9, 10, 121 about the disease prevention control. Okay, they're talking about the communicable disease, that's what it's all about, and the infection and then the respiratory symptoms. Mostly the care homeowners are getting ding on the letter D, but let me go ahead and discuss letter C. An administrator or manager, as applicable, shall ensure that policies and procedures are established, documented, and implemented to protect the health and safety of a resident. As you guys know, sometime in March, the governor has been issued a decree that everybody should have a policies and procedures, especially the healthcare industry. And so we are affected by it because we are an assisted living community. So again, you have to have your policies and procedures according to the rules, and make sure you have to implement it. Don't just put it in your binder and you have to implement it, okay? Because otherwise you guys gonna get ding, and it's deficiencies. Okay, number one, under letter C, you cover screening and triage before entry of personal members, employees, visitors, and any other individual. So you have to screen them by having the temperature taken. You have to go and make sure that you have a sanitizer in place and things like that. Number two, cover the manner and frequency of assessing resident to determine a change in a resident's medical condition. You have to have a form that assess your residents if their medical condition has changed. If you have noticed that they started coughing, they started having those fever or things that is the symptoms of COVID, so make sure that you guys are aware of it. So you have to assess them on a regular basis. Number three, establish disinfection protocols and schedules for frequently touched surfaces. So meaning you have to disinfect all the surfaces that needs to be cleansed. Okay, you have to have a wipes. You have to do it on a regular basis. You have to have those alcohol base, or you have to come up with disinfection so that all the surfaces are going to be cleaned. And you can do that on a daily basis, or you can do it on a weekly basis as well. So you have to establish that disinfection protocols. Number four, specify requirements for distancing residents who exhibit symptoms of communicable disease from other residents to reduce the chance for infection or another individual. Because right now, it is mandatory to have a social distancing at least 6 feet, away from each other. But in the home, you just have to have that. If you don't have that 6 feet away, at least you can ask your residents or your employees to wear a mask or face shields, because face shields is, I think, it's appropriate for our residents because sometimes they couldn't breathe or something like that. So, but again, you have to establish a 6 feet away social distancing. Okay. Letter D. Okay, this is the one that I'm going to emphasize because most of the care homeowners are getting ding on this one. It is mandatory for us to do the assessing, and we can ask about, when they're entering your facility. Make sure you have those in place. So number one, before entering the facility, each individual, including a personal member, employee, or visitor, is screened for fever or respiratory symptoms indicative of a communicable disease. So especially Department of Health Services are expecting you to do the same thing. So when you come in, I believe it is very, very important. When they come in, it is very important to have your temperature gauge, check them out, and make sure that they don't have that proper they don't have a fever. You have to look for those symptoms. They don't have a cough, and they don't have a shortness of breath. But the most important thing is to check their temperature. You have to invest yourself with a good temperature gauge so that you can get your protocol ready. So a lot of care homeowners, they are getting dinged because of this one. They don't do their protocol. Okay, number two, if an individual refuses to be screened, the individual is excluded from entry to the facility. Okay, so if they refuse, you have the right to refuse them entry because you are protecting your residents. Okay, when they're coming in, if they refuse, probably it's better to take down their names, the date of time that they came to visit, and that way you have a record. While they are refusing to get to your protocol, there must be a reason. Okay, number three, if an individual is determined to have fever or respiratory symptoms, the individual is excluded from entry to the facility until symptoms have resolved or the individual has been evaluated and cleared by the medical practitioner. So again, this going to be applied to your caregivers, to your employees, and to the residents also. So if they have those symptoms, make sure that you advise them to get tested, and make sure that they have a clearance from the doctor that they are negative with the COVID-19. So you have to have that clearance. Number four, if an individual other than a resident develops a fever or respiratory symptoms while in the facility, okay, the individual is required to leave the facility and not return until symptoms have resolved or the individual has been evaluated and cleared by the medical practitioner. All right. So this is similar to number three, but the only difference on this one, if they developed, okay, the number three, if they don't have it, they don't have it yet. But again, the most important thing here is to get a clearance, okay, and evaluated by the medical professionals. Number five, if insufficient personnel members are available to meet the needs of all residents in the facility, the administrator or manager, as applicable, implements the disaster plan required. So, this may include moving a resident to a different facility, or right now, I believe the Department of Health Services are coming up with something that if they found out that the resident in the facility has COVID-19, I think there's going to be a protocol that they need to be moved out of the facility and go to the designated COVID-19 facility. Okay, you just have to keep an eye on that, because from time to time the rules has been changed. But right now we're just talking about and studying the article R9-10-121 about disease prevention and control. And of course, the letter E, an administrator or manager as applicable shall ensure that an assessment of a resident includes whether the resident has a fever or respiratory symptoms indicative of communicable disease and is documented in the resident's medical record. Okay, you can always, the assessment, you can come up with questions, when you guys doing some assessment to your residents. Find out if they have a fever, if they have shortness of breath, if they have cough, and you can also ask them if they were exposed to the person who has contacted with COVID-19, or did they travel or something like that. So come up with some questions that you have to include that on the assessment and maintain that in their file. Then, if a resident is found to have a fever or respiratory symptoms, indicate of a communicable disease, and then you can just check the protocol after that. And the resident is evaluated by a medical practitioner within 24 hours, so you have to check with the PCP to determine what services need to be provided to the resident and what precaution need to be taken by the facility, and the evaluation is documented in the resident's medical record. So again, if you have those residents that has these symptoms, you have to call the medical practitioner to get them evaluated and put that on the medical record. To reduce the chance of infection of another individual, again, these are the residents who are staying in your facility, keep at a distance of at least 6 feet from the other residents, or you can isolate them in the room. Okay, if not possible to keep the resident a distance from other resident, required to wear a face mask. Again, if some residents, sometimes they cannot breathe, we have some face shields that you guys can utilize. Next is the personal member. Take precautions, which may include the use of gloves and face masks or other personal protection while providing services to the residents. You know, the surveyor, sometimes they're really observing if your employees are wearing those PPEs. Make sure you have them available. Removes and, if applicable, dispose of the personal protection equipment and washes the personal member hands with soap and water for at least 20 seconds. If soap and water are not available, use a hand sanitizer containing at least 60% alcohol immediately after providing services to the resident and before providing services to another resident. Next, the linens, dishes, utensils, and other items used by the residents are to be kept from similar items used by a resident who does not have a fever or respiratory symptoms indicative of a communicable disease. So you have to be careful on those, okay? So the most important thing what you can do is to always check and assess your residents. Disinfect or dispose of in manner to reduce the chance for infection of another individual. And surfaces touched by the resident are going to be disinfected before another individual touches the surface. So again, it boils down to hand washing, and make sure that you always disinfect all the surfaces, especially the doorknobs, anything that they touch. And sometimes, even though they are using their own walker, wheelchair, any DMEs, make sure that you always sanitize them and have time to do that. All right, so that you can keep your residents and your employees well and safety. Okay, letter F. An administrator or manager, as applicable, shall ensure that door handles, tables, that's the one that we're talking about, chair backs and armrests, light switches, and other frequently touched surfaces are clean and disinfected according to the policies and procedures, with at least an alcohol solution containing at least 70% alcohol. Okay, 70% alcohol is the one that you use to disinfect and clean. 60% alcohol is the one that you're providing for the hand sanitizers. Okay, a bleach solution containing 4 teaspoons of bleach per quart of water. So these are the things that you guys can put together or come up with your own disinfectant, as long as you are going to follow the protocol. And an EPA approved household disinfectant specified can be found on the epa.gov site. So you can always check Arizona. You can always check a different protocols on how to keep ourselves safety and follow our protocols for the COVID. Again, thank you so much. This is going to be a very good lessons for us to learn, so that we can avoid our deficiencies, and of course that will keep us safe. Again, thank you so much for watching, and this is our episode for Let's Talk. Thank you.